Hello, I'm Dr. Robert LaBelle. Today we're going to be going through ball release for the upper shoulder blades and the lower neck. Ariana is here to demonstrate. If I can have you turn around, Ariana. What we're going to be releasing is the levator at the attachment to the shoulder blade, and it's what we call the superior angle of the shoulder blade. And as well, we're going to release down through the rhomboids. This area is an area of major pain for people who sit all day long at work or people who have any sort of rotator cuff injuries or the like. The third ball release exercise we're going to do against the wall is a bit more advanced, and we're going to be releasing the upper trap. But to initially show these two exercises, let's have you go against the wall, Ariana. Ariana's going to place the ball on her shoulder blades, bend her knees, go put the ball against the wall, and then she stands up a bit tall. And what that does, she's going to bring the arm across the body. What that does is it's capable of positioning the ball right at that superior angle of the bone right into here. And then what she's going to do is just friction back and forth or up and down in a slow, controlled manner. What we're doing here is we're looking for soreness. You're looking for discomfort. We don't want you to be causing a significant amount of pain, just a slight amount of discomfort, and you're going to try and release that tissue with a massage. In this video, we've shown Ariana turned this way. Ultimately, we're doing that for camera purposes, and in the future, she's actually going to turn oppositely into the shoulder blade, bringing the ball right into her shoulder blade and going up and down, bending the knees. She's doing it in a very slow, controlled manner, and that is exactly what we want to see. Okay, to target the second muscle, Ariana's going to come off the wall. She's going to position the ball in the same spot. She's going to bend her knees a little bit more and then place the ball against the wall. And then you'll stand up tall, Ariana. Continue to bring the arm up and across your body. And now the ball is positioned further down on the shoulder blade in a muscle group we call the rhomboids. And this muscle group is very often quite sore. That goes along with the neck pain. And same idea, she's going to go up and down in a slow, controlled fashion, thus releasing that tissue. That looks good. As for demonstration purposes, again, she's turned into it. What she really wants to be doing is turning this way and turning into the ball and then releasing. Good. The third exercise we're going to go through is the upper trap release. This is a bit more of an advanced procedure, and it's to help aim at releasing right up here in the trap. So what you're going to do is put the ball in your trap and lean forward into it. I'm going to step over here. What's happening here is she has to be at a parallel position to the floor to be able to get on top of this tissue. The two prior exercises are in the back so she can lean against the wall. This one's a bit more difficult. The ball is positioned right in the crook of the neck, so you can actually position it a bit further in. Good, perfect. And you're looking for soreness again, and she can move up and down very slowly to try and release this tissue. Or she can actually tip the head to the right and rotate and pull the ball out and release like that. All three of these ball release procedures is aimed at trying to release soft tissue tension in the upper back and lower neck and release trigger points. It should be done slowly. There shouldn't be a significant amount of pain, and subsequently it should be done for about 3 to 5 minutes, 2 to 3 times a week. Don't do this every day. Done daily, you can come up. Done daily, it would basically cause too much soreness in the area, and you need some time for the tissue to regenerate. To further complement the release with the ball, we typically show foam roller release of the back. These are very common physical therapy exercises to help release the mid-back joints and some of the soft tissues. Some patients prefer this exercise over the ball. Typically, I show them both because at times I'll want you to do both. So initially, we're going to just do a muscular and mobilization release of the mid-back. Ariana is supporting her head with her hands. Her feet are shoulder width apart, and what she's doing is she's just going back and forth over her back. You can hear some cracking noises with this. All that means is the joints of the mid-back are moving, and that's something that we want. As well as you can get some discomfort with this because what you're doing is you're releasing the soft tissues. She can augment this therapy by turning about 20 degrees. That's good. And now she's really targeting one side, and it's a little bit more sore doing that just because you're putting more pressure into one side. This would be equivalent to doing some of the ball work as well. In both of these exercises, we don't want you, slide this way a bit, this way. We don't want you going too far down into the low back. This is really a mid-back exercise. So from about the shoulders to about the end of the rib cage, and you're just releasing through. There's one last exercise with this, and it's more of an advanced procedure, and it's not recommended early on in back treatment, and it's more of a true stretch to the mid-back. And what we do with this, roll this way just a bit, good, and now drop your head. You're not going to be able to support your neck too much, so if you have a lot of neck discomfort, this exercise is not going to be possible for you. So what Ariane is doing is she's cresting over the foam roller. And what this is really doing is it's really stretching the spine out. Like I've said, this is an advanced procedure and it's not recommended early on, but as time goes on, this is something we'll do. We do not roll back and forth with this exercise. We just hold a really good static stretch for about 30 to 60 seconds, and then she can roll just a bit to the next level and hold that for 30 to 60 seconds. The ball release, you can come on up. The ball release and the foam roller work is really aimed at loosening up the soft tissues of the shoulder blades, loosening up the joints of the mid-back, and getting everything free so that you can sit a little bit taller and take away that pain or that burning ache that resides in between your shoulder blades.